We're late.
Yes, we are a little bit late, but hey, everybody, here we are on a lovely Friday. Happy Friday, y'all. Afternoon. It
Yay.
is noon on the Eastern Standard Coast, and I am here with Mitzi, who is also the public health renegade.
Yeah, that's me.
So, hey, what's up? What do you want to talk about? What are we doing?
Well, I'm not sure what I mean. We can talk about anything and everything, but I'm just wondering if we should just take questions or should we introduce ourselves? Like why should these people tune in and listen to what we have to say?
Okay, I'll let you go first since you're the guest on my channel.
Okay. So I'm known as Coach Mitzi. I have a master's degree in public health with a concentration in nutrition. I'm a functional nutritional therapy practitioner and an adjunct professor at George Mason teaching public health. And I've known Dr. Bavry since 2017. And his method works. What he has to say works. He resonates with people. He gets results, which is evidently very clear when you see that he's starting the American Diabetes Society, which is an exciting thing.
Super exciting.
Yeah, it's very exciting. And I had a very long list of health issues, but I don't identify with having any of those things anymore. So I always have to refer to a list. But like the key ones would be obesity, fatty liver, what do you call it? Heartburn, acid reflux, attention deficit disorder, depression, plantar fasciitis, all that stuff. And that's resolved. And my eyesight is improved in 7 years. And it just had several positive health recovery things occur. But as Dr. Bavry says, the proper human diet doesn't make us bulletproof. And for 44 years, I had breast implants, and I finally had those removed in 2021.
Okay.
And I developed Hashimoto's, and that was pretty much the trigger for having those breast implants removed. But my health markers are moving in the right direction. I'm postmenopausal, and that just opens up a whole bunch of other things as a woman who is trying to stay healthy. And I'd be happy to answer questions on that and tell you what it's like to be a postmenopausal woman. But that's enough about me. What about you, Becca?
Me, so I'm just a regular person out here in the world. No, but really I am though. So I'm a nurse, certified ketogenic nutrition specialist, certified primal health coach. Came on board with Dr. Bavry as a coach this year, but I've been following him for years, been in his community since December of 2022. I started ketogenic diets in 2018, and I started kind of dirty, says dirty keto. And I kind of went through and just, cleaned it up as I went along. Did a stint as, carnivore, went back to ketovore, and I flip-flop between ketovore and carnivore, depending on my mood, so like I might be carnivore 5 days out of the week, and 2 days I'm like, yeah, I'm going to eat some crunchy water with glyphosate in it with my meal. That's lettuce for anybody who doesn't get the reference. So yeah, that's me. I'm also a nurse practitioner candidate right now. So finished up my first year. I am a part-time student, so it'll take me longer than the normal, person to get through it, but slow and steady wins the race. So
yeah. Oh, two things I forgot to tell you.
No.
My diet evolved from just eat real food. If it grew from the ground or had a mother, I could eat it, which includes a lot of things that I don't eat anymore. But I immediately started seeing health improvement. Then I became paleo, which again improved some health. Then low carb, on the low carb cruise, which we're going on in 2 weeks.
I know, I'm so excited.
Year that I went, it was 2016. They started talking about keto, that's where I first was even exposed to the term keto. And I said, well, this looks pretty
Interesting.
simple.
Mhm.
Let me try it. And boy, that was a game changer for me. So that's how my diet has evolved. So I started with common sense, very similar to what Ken and Nisha did. And then
Yeah.
another thing I forgot to tell you, I'm a PhD student in health science. So I am a part-time student too. So I'll be doing homework on the cruise. Here on break, and I'll be doing homework. I start summer school.
Mhm.
There was one question in the chat. What blood tests check for
Fatty
fatty
liver.
liver? It's
That's
liver enzymes.
yeah. It's going to be your liver enzymes. And really, to really diagnose fatty liver, I mean, your liver enzymes can be elevated for all kinds of reasons, like anything. So I'd say probably also a scan. You'd want to see, like, to actually see the fat on the liver, you need a visual test on it. So that's going to be some sort of a scan. I don't know if that's a CT or an MRI, but MRIs seem to be the gold standard for tissue um,
Mhm.
differentiation. So
Well, here's what I have to say. If you've been following the standard American diet, before you came here, odds are you have a little bit of fatty liver, and you
well,
really
fatty
don't need.
anything. I think
Yeah,
fatty anything, either
yeah.
marbling in your muscles,
Mhm,
because Dr. Sean O'Mara talks about that, you know, marbling in your muscles, your heart, fat around your heart, fat around your pancreas, fat around your liver, fat in your tongue. So if you've got sleep apnea, you got fatty tongue. It's
mhm.
like, a lot of it.
Those beeps are my, government computer shutting down because it's been dormant. So, see, I
Yeah,
can't walk
I
away from.
recognized it. It sounds like my husband's when it's here and it shuts
Yeah,
down. It's like beep,
yeah.
beep, beep. I'm like, oh, your computer's going off.
Um,
I don't know what you're congratulating me for, Cynthia, but I appreciate you and thank you for saying congratulations.
yeah.
If it's
Um,
if that's about finishing my first year, I am going to toot my horn because I busted my rear end. I got a 4.0 for my first year, and so I'm pretty excited about that.
so there's another comment in the chat. It's from Janet, and she connected the dots. Both Nisha and I had implants, and both Nisha and I had Hashimoto's, and she wants to
Mhm.
know what's the difference from the implants and the mesh. She feels that the mesh could be causing problems. So here's what I have to say about that. Um,
I
I
think she's hitting on something super important right here.
I think that I think that when you put anything into your body, any foreign object into your body, that depending on who you are, what your constitution is, how resilient you are, how healthy you are, how inflamed you are or are not, you can have really severe reactions to having something
Implant.
placed in there that doesn't belong. And as far as mesh that's been used in some of these surgeries, I'm not trying to be an alarmist, but you need to do your research, look through your medical records, find out what type of mesh was used, what the procedure was, and then look to see if that's one of the mesh products that can be problematic. So I'm not trying to be an alarmist, but you need to do your own research.
I think
And
that's anything. I think that's anything really that you put in your body that's not real. Because because I have a tooth implant. Um, one of my back molars, I had to have an implant put in because I had an autoimmune already at the age of 15, an autoimmune reaction to one of my teeth. And at the age of 30, it was pulled. And I just got the implant done in 2021. And I was talking to my new dentist here in North Carolina, and you can absolutely reject those. So that is an immune response. Your body rejecting anything is an immune response. So you can eventually have an autoimmune response to a titanium implant because this is
mhm,
titanium. It's supposed to be the safest one. So anything that's foreign that's in your body can attack. So
mhm.
it's just,
And
it is.
Janet also shares another comment that I'm astonished. She would not have known that mesh was used, except the doctor gave you a VHS of the surgery. So let's see, he used a mesh that you weren't aware of,
That
taped it.
you asked him not to use. That
Yeah.
right there is, if especially if you have that in writing, that is considered something called malpractice.
You know, and unless there's some type of something in the fine print that says, you know, we will do all that we can to abide by the patient's wishes unless there are extenuating circumstances, and
Yeah, but that's
we
but
can't.
but inputting mesh would never be considered a life-saving event.
Yeah, I did.
I
Well,
don't
you
know how
know,
that would.
we're armchair quarterbacking at this point, but
Yeah.
I'm just shocked, and I thank you for sharing that because, you
Yeah.
know, that's
I'm
and
so sorry too. You can't have them removed though. I will say you can absolutely have anything removed. So if they put a piece of mesh in, I've seen where stuff happens with the mesh, an infection happens later.
mhm,
Um, or like tissue necrosis happens later. Not trying to scare anybody, but crap does happen. And then they'll go in and take it out, but then they usually replace it with a different one. But you can do that. So,
wow.
I mean, I just keep an eye on it.
Mhm, yeah.
Thank you, Julie, for hopping in here, waiting on your hubs to come out from his coronary CT angiogram.
Well, if they can get his heart rate down. So does he have white coat syndrome?
I have it so bad. It is. I have it so bad that my doctor looks at my blood pressure now and he's like, "Your blood pressure's fine. It's 150 over like 78. It's fine. You're great." And I'm like, "I don't like you. That's why." And I actually do like my doctor, but it's like I just don't like white coats. They're horrible.
Well, yeah, they're like the 3rd leading cause of death, right? Doctor
Oh my
Error or
gosh, it's
something
so
like that.
hey, I'm going to try not to be that person. I am going to do my best when I am a nurse practitioner. And my husband makes me say when I am a nurse practitioner because I
Yeah,
have self-doubt so much. And I'm like,
no,
if, no, he's like, when? I'm like, thank
that's right. It's when, it's not if, it's
you.
when, because
So,
you are just as I am, and
yes. I'm excited though. I do want to talk about the American Diabetes Society.
Mhm,
I do because I'm so excited about it. And I've got people that I'm friends with in the ketogenic community, whether they're, paleo all the way up to, super carnivores. And people are like, "Oh my gosh, I love what Dr. Barry's doing. How can I get involved? How can I get involved?" And I'm just, hey, send a resume, let's, send a resume. This is how they're going to have tiers of membership, you know. So just keep a watch out. Share the fundraiser because we are
mhm.
really needing to meet this goal, um, to get everything up off the ground and running because it will take money. Unfortunately, we're gonna,
Everything. Well,
yeah.
you know, people can't and shouldn't not have to work for free. So you have to pay the lawyers and you have to pay there are
Mhm.
fees associated with establishing a business and establishing um, a 501(c)(3), which is a nonprofit.
Yeah. As of right
Well,
now, everybody that's working on it is working for free.
mhm, yeah,
Eventually it will be paid positions, just like all the other 501s.
mhm, right.
um, Cynthia, no, the only way I know really is the GoFundMe. If you have an issue with the GoFundMe, or if there's something like, you know, you might be able to reach out to one of us and we might be able to make some arrangements to help if you're like an anti like GoFundMe, or maybe you just aren't really good
Okay.
at working with it.
I also want to point out, get out ahead of this because
Mhm.
Dr. Barry and I have had multiple conversations on this. You know that they're going to come gunning for him. You know,
Oh, they're gonna come gunning for every
yeah,
single one of
they
us.
they are, and you just have to hunker down because when they attack the person, keep in mind, when your argument is attacking the person, you
Mhm.
you have no facts or data or anything to back up your position. So it's an ad hominem attack.
Yeah.
They're going to attack him.
They're
They're
going to attack him. I'm worried about Dr. Westman because of
yeah,
him at Duke, because he's at Duke and he's got that very well
well,
established
well,
clinic.
well, I worry less about Eric because Dr. Westman, because he has been navigating this minefield for years.
Yeah.
So I think that I think he will be okay. And and Dr. Ben Bickman, I believe, and correct me if I'm wrong, I don't want to step in it. Is he an MD or is he a PhD?
He's a PhD, but
Okay.
he's the third board member.
Okay. So so they'll be able to
I don't think they'll bother with
come after him on the science. But look,
his science is infallible though.
yes, and the thing about science is when you say the science is settled or there's consensus science, pardon me, that's bullshit.
It is.
Okay, if it's consensus, it's not science, and if it's science, it's not consensus because science sometimes takes you where you don't want to go.
And yeah, well, I mean, and that's, I mean, look at ours, the science behind our whole philosophy of why we eat. Like the science took it someplace else, with Ansel Keys back in the day, and they just continued to it's like a dung beetle rolling a pile of crap, just keeps collecting more, and now the science took it in a different way, and now they're fighting it, and eventually they're going to have to give in eventually.
Well, this was no secret. I've shared it among my peer group. I told when I was in a conversation with Dr. Barry, I told him, and then he announced it on a live that I actually had a professor give me a 49 on a paper because I wrote it about reversing diabetes and how I said that the standard of care for diabetes doesn't take it far enough and that reversal should be the goal. And she told me that diabetes is a chronic, not reversible, chronic debilitating disease, and that if you reduce somebody's A1C from 11 to 9, that they're healthier. Well, you can reduce it from 11 to 5.6. How about that?
Yeah.
And then they wouldn't be a diabetic anymore. So I have to face that professor again in 2 months or so. So I am just going to be a Stepford wife and just write the paper that she wants, where I'm just going to quote and everything the American Diabetes Association is, the ultimate end all be all. And to get through the class, because you can't be a public health renegade if you don't have the damn letters after your name.
I know. Well, Frank, doctor says LDL should be lower than 70. Where do they get this number from? Do they just make this ish up?
Yeah.
Yeah, they do. They absolutely yeah, they absolutely do. Because even in my pathophysiology book, which was super interesting, it states the 75% of people who come in with a myocardial infarction, and that's the technical term for a heart attack for anybody that just does not know, they all have absolutely normal LDLs. 75% have normal cholesterol levels when they come in for these events. So, what did they do? They pulled it out. Why did they pull it out? Because that means if they lower it to 70, more people are on the life-saving drugs, statins. However, the science behind statins is false and I think over-exaggerated.
Well, oh boy, we could do a whole
we could do
the whole thing on statin drugs, but here's what I found in my research on statins and cholesterol and all that stuff, because once you jump down that rabbit hole, you spend a lot of time down there.
Yeah.
So statins it was discovered statins originally were prescribed for a different condition, not to reduce cholesterol. It turned out that serum cholesterol reduction, the total serum cholesterol reduction, was a side effect of this drug called a statin. So if you can measure it, you can study it, right? So the class that I'm getting ready to take, you have to come up with a perfect clinical question. And the question has to be specific enough that it can be researched and answered. So if
So
you
is
can
this will
study
be
it,
your PICO question?
yeah,
Yeah.
PICO and mesh. And so anyway, statins reduce the cholesterol. If you can measure it, you can study it. So someone got the bright idea. Well, we can prescribe this to lower serum cholesterol. At the time, before statins hit the market as a cholesterol lowering drug, the average, this is an average, the bell curve, right? Go up and then you come down. Vast majority of people were at the top of the bell. The
So we're in the
average
middle.
serum cholesterol was 240. That's the average. That means there were a whole bunch of people with higher and a whole bunch of people lower,
Yeah.
but 240 was in the dead center. And they got together and said, oh yeah, well, why don't we make it they said we need to make the standard of care, if your cholesterol is above 240. And some really smart entrepreneur in the group said, well, why don't we lower it to 200? And we just created all additional customers.
Mm-hmm.
Okay, 240 was normal and it was the average. So then it was 200 and now they're down to 180, and that is absolutely crazy. And I believe I've read this, and if you want me to cite it, I can look it up and find it. But Eisenhower, when he had his heart attack, his fatal heart attack, his cholesterol was 172.
Imagine that.
And he ate margarine and dry toast and egg white omelets. And yeah, he pretty much had a miserable life before he had his fatal heart attack.
You should enjoy your food.
Yeah. So,
Yeah. Yeah.
Speaking
go ahead.
Well, no, I was just looking at the chat and I think we covered everything, but do you want to open it up to ask me anything?
They can ask us whatever really that they want. If we don't know it, then we'll say, if it's outside my scope, I'll say, hey, that's a Dr. Beep question, or, ask your own physician. So we have 23 people watching currently at this moment. At least on mine. I don't know if you restreamed it to yours.
Oh, no, I didn't. Hey, Salty Grass, thanks for your comment about me playing the game. I've been playing the game since May of 2020 when I started this whole thing. Yeah. So I started studying public health in the middle of the pandemic.
I tell you what, I've had to play the game a little bit too, just to get my grades.
Mm-hmm. Yeah. Every time I had to provide an incorrect answer on a test in order to get credit for it, I would take a picture of it, post it, and cry about it. I mean, not really cry, but cry.
But it hurts. And it actually just gets stupid angry. I just get angry.
Well, and the fact that people just don't know. They don't, and they believe, bless my mom's heart, she has AFib, she's on low salt, she has swelling in her lower limbs, and yeah. So, and I'm like, Mom, it's not the salt. Truly, I promise you, it's not the salt. It's your lack of salt that's causing that.
Hey, Julie, there is a book. Hold on, and I can show you the book.
Oh, Julie, there are several books. While she's grabbing that book, I will say that there is a book called Cholesterol Clarity, and that's Dr. Westman's book. That book, Big Fat Surprise, Nina Teicholz, that's an excellent book.
This one covers the entire history of cholesterol, of just the BS about food, and it goes all the way back to just really the controversy of Ansel Keys. And for diabetes, yes, although
I think
I've not read it yet.
I think there's also a book called The Great Cholesterol Con, and I think that's by Malcolm Kendrick. I'm just Yes, The Great Cholesterol Con. So there are several books. You wouldn't necessarily have to buy them, but you could probably get them from your library and read them.
Yeah.
Yeah.
So this one is the newest one out there about the whole BS of diabetes. And this is Gary Taubes. If you don't know him, go look him up because he's brilliant, amazing investigative journalist.
So here's a really good question. Chris B has a good question, and so does CJ. And Chris
Yeah.
B, I'll answer, and then
I can pull these up too. Sorry.
Okay.
Which one is it?
There's the whole thing about bird flu and the cattle and all this. Okay. So I do not believe that birds and cows are swapping spit and having like it just seems a little bit contrived to me. And isn't it convenient that it's the cattle that are getting this disease and then they have to be culled, and cattle are meat? And interesting. So I believe it's just hype and you're supposed to be scared. And every time you see that, you need to roll your eyes, in my opinion. And that's how I'm approaching it. Then this next question.
The CJs?
Yeah. It's totally worth it to get the credential after your name because, and I'll tell you why. With that credential, I'm teaching college with that credential.
Mm-hmm.
Okay, as I'm working toward a PhD, but I'm teaching undergrads. It gets you a seat at many tables. It gives you credibility, and it makes me really happy when I see people, especially MDs, that have their MD, MPH. I'm like, yes, so I would say go for it. And what is your bachelor's degree in? And I'm just waiting for you to respond.
Yep.
So
I'm waiting. I'll pop it up as soon as she says it.
You have to realize that, going back to Chris's question about the bird flu and the cattle and this and that, I said a long time ago when I hate to be right, but I said a long time ago that in 2024, there's going to be something else that's going to pop up, and the timing of it is going to be such that things are going to be, it's going to almost look like a cookie cutter of what happened in 2020. So
please, I hope you're not right.
And then you just have to just be aware of it. You have choices now. That this is me speaking from my personal opinion. I do not believe that people would stand for another mandate of any kind. That's my opinion. A mandate on anything. I believe that we've learned in the past 4 years how important health autonomy is. And that health is not injected. You do not inject health unless you're so infected and you need to have some type of IV antibiotic to save your life. Then I would say, yeah, you can inject health that way. But injecting health with that, I'm not a believer.
So CJ's bachelor's is in communications and human services, and she had CJ, I don't know if that's a she or he.
I have an EMT.
EMT. Oh, and can no longer go that direction. I can understand that. It's hard. EMT is hard, strenuous work. So.
Okay.
I'd get your public health.
Yeah.
I mean, it gives you credentials, if nothing else, because that master's is needed to do to teach.
Huh.
I know that even in high school now, they're starting to ask for you to have your master's in high school
No, to teach high school?
to
Yeah.
teach high school. My
Um,
friend has her master's in English to teach middle school children.
well, another rabbit hole that we can go down is like the whole education system. So I
Yeah.
remember I remember, I believe that it was Carol Burnett, who is, we all know Carol Burnett. She's an iconic actress from the late 60s, early 70s. She's still kicking. I think she's like 90. She's in her 90s. She's still, very coherent. But I remember her telling a story when she graduated from high school. They were very poor and she wanted to go to UCLA. Now, keep in mind, she's in California, UCLA. Back then, it was got to be the 50s, maybe
Mhm.
50s. And she needed $500 to go to college.
Jeez Louise.
I needed $500 for my friggin' books. Okay. She needed $500 to go to college, and she had an aunt who gave her the money so that she could go. And she was able to go to college because she was given the $500. Used to be that you could go to college, you could work a part-time job, like work study was a thing, and you worked and you paid as you go. Now, I'm getting my degrees paying as I go. My tuition is very reasonable through Liberty. It's not that high. And my tuition is free at George Mason. If I wanted to take classes at George Mason, I could.
I wish. I'm gonna have to do loans for mine. But.
And so you do not have to go crazy in debt to get this degree. But think about this. Like, I have a daughter who's 22. When she was 18, if we had gone to the bank and said, she just got accepted at XYZ University, it's $27,500 a year, blah, 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 blah. She could have financed that for 4 years and be $100 and some thousand in debt at age 22. But if the same 18-year-old daughter went into the bank and said, hey, I've got this business idea, and I would like to take out a business loan for $25,000, and here's my plan, and her plan is impeccable, and why would you not want to take a chance on her? Her plan is foolproof. No, we can't loan you that amount of money because you don't have any way to pay it back. You don't have a credit history. You don't have an income. I didn't have a credit history. I didn't have an income, and I didn't have any way to pay it back when you loaned me $100,000. It's a scam, people. It's a freaking scam. Okay.
So Chris says that he has a master's in engineering management, grad certificate in healthcare analytics. So if nothing else, you've learned how to pick apart a study.
Oh yeah.
Which is a really good skill to have.
Yeah. I find I can find the Achilles heel in every single one, and I cannot wait.
Yeah. And in fact, we were going to talk a little bit about that, and we can throw in a couple things. So I just finished that class.
Yeah. JAMA wrote the textbook. Please. Yes. Please let the fox guard the hen house.
Oh, I know. Mine did not. I sent my books back because I rent them. So mine's already on its way back. So picking apart a study, there's a few things you just want to look at. And this will tell you everything, basically, whether it's valid or not. The first thing you're going to look at is you're going to look at the title. You're going to see what they're looking at in the title. Does the title language, talk very, is the question that they're postulating very biased? That'll tell you something right there. You're going to look at the authors and then go all the way down to where it says at the end of the study, it says conflicts of interest. They're supposed to declare, they don't always, but you can look at your conflicts of interest and that'll tell you whether it's valid or not. Because if it's like, hey, Bob here did all the analytics and it's on sugar and he gets paid by the Coke industry, or that Coca-Cola pays a salary. Well, probably not a good study to look at, And then, after that, you look at the conclusions and you'd read through the conclusions. And then you look at the abstracts and you see how they got to those conclusions. And that's how I basically pick apart my studies. It's like a back and forth. You just can't read them and take them at face value.
Well, I look at the methodology, inclusion
Yeah, that
criteria.
too. Yeah, you got to look at the methods, and that's usually outlined in the abstract.
Yeah.
Also,
Um,
so
for instance, I watched a video someone shared with me. Don't worry. Let's see. CJ has a question. I'm going to address it as soon as I tell you this one.
yeah,
Somebody was spouting off a study that lasted for 8 weeks,
yep,
16 participants.
yep.
They were all young all college athletes. And it
Mm,
was,
okay, that's a bias sampling.
yeah, and they fed one of them vegan diet, and then
Mhm.
they had no decline in their athletic performance.
Okay. Well,
Well,
it's
a
only 8 weeks.
20-year-old is not going to have a decline in athletic performance in 4 weeks of eating as a vegan. Their constitution is too strong, and they're
Well,
very
and you're looking
resilient.
at a 20-year-old. They just went, you know, they just went from eating college crap to eating whole foods probably.
Yeah,
I mean,
so,
so no wonder they're like they wouldn't have a
and
decline,
and
they're not eating pizza and
he
like
was so
beer.
proud of those results, but then it's like, "Well, how did you get there? Let me see the path you took to get there," and then I
Mhm.
just rolled my eyes. So, CJ has a question. "I have a fear about getting a job in public health and being expected to spread lies." Okay, so there are many, jobs that you can use your public health credential and you don't have to spread lies.
Yep.
Okay, and, I have a friend who is a, OBGYN nurse, and she worked for, Kaiser Permanente, which is a big, humongous, well-known
Very, very,
organization,
very
and
long
she
long.
used to have to counsel the ladies who had gestational diabetes. Now, what she wanted to do, and she had to put a sock in her mouth every day, was you need to follow a low-carb diet, you need to be blah, 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 blah. No, she just gave them, their little blood test kit and their little diary, and she said, "Now, when you need to eat your breakfast and do your blood sugar, and then in X number, whatever, when you come
Mhm.
back, we'll look at it." And so what she does is she leads them down the primrose path of, okay, on Monday, you need to have your oatmeal and you need to do this. And then Tuesday, bacon and eggs. And then Wednesday, da, da, da. And then she has them look at it and say, well, look at what your blood sugar did when you had the oatmeal versus what your blood sugar did when you had the bacon and eggs. And then she goes, um, what do you think you should do? And then the patient's like, well, maybe I need to eat more bacon and eggs and not so much
The
oatmeal. Now, the thing that is so shameful about that is she had to do that surreptitiously. Get them to connect the dots instead of telling.
But
Some
that's
people
okay.
need to be told.
Yes, but that's okay. If that's how it's gotta
Mhm.
happen, I'm like, I love it. If it's gotta happen, you gotta happen. It's gotta happen that
Now,
way.
there are other things that you can do, as I said, in public health where you're not gonna have to spread lies or you can, look, I teach intro to public health, and when we talk about stuff like that, I say things like, "Well, the American Diabetes Association recommends this, but, um, that's really not supportive of good blood sugar management." I think other studies have shown I just get them to think. I just get them to think about it.
Mhm.
Or they'll put stats up there and I'll say, "I'm not so sure those statistics are still accurate. I think it's probably changed since then," just to get them to think critically. And I do share my opinion when they ask me, and but you have to be very careful because all it takes is one to report you, you know? So
Yep.
I'm very cautious. I always say, "This is my opinion. The textbook says this, but this is what I think."
Yeah.
Um,
Love
yes.
reading studies, but they are very involved. Yes, they are very involved. I was gonna print one out, recently, and it was, like, 60 pages long. I was like, "Well, I'm not printing that off right now. I can't afford that much ink."
Mhm.
Um, so Julie joined the Air National Guard in Ohio for a tuition
Yeah.
waiver. Very smart.
Yeah, and see, I see people on
Very
social
smart.
media say, "Hey, the government should relieve your college debt for 4 years of military service," and I'm like,
They already do.
"They do that already." That's the
Yeah, no
thing.
kidding. Let's see,
Uh,
what's this question? Oh, been strict? B, 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 and E, then added sardines and shrimp. Total 5.5 months. Gained 8 to 10 pounds at the beginning, lost 4 doing forced OMAD, upped fat to consistent 75 plus for the past week. Any further advice? Well, why are you forcing OMAD? Are you doing it to try to to force losing weight? Because if you gained 8 to 10 pounds at the beginning and then didn't gain any more, eventually it's going to start melting off. Like it's going to stop. It's going to start eventually. Remember, Kelly Hogan, if anybody has ever followed her story, she gained like 60 pounds in the beginning. It was like ridiculous, like how much that she gained. If you look at her now, I mean, she wasn't restricting. She just,
Okay.
yeah.
Okay. So she's shared further information.
558. Okay. So are you postmenopausal? 5'5", 199, had previously lost a normal BMI on a low carb, low fat, high protein.
Okay.
So no woman should ever be low fat ever.
Well, I think you could get by with doing the fat that's attached to your protein.
Yes, which would be considered like moderate,
Yeah.
which would be like a moderate fat.
Yeah,
Nobody
totally
should ever
agree.
be like, I am going to eat nothing but grilled chicken breast with no fat and tuna. Because nobody should really even, and this is who else was it that said this? I think it was Natalie Grosso said something like she doesn't really recommend even women going below 80, usually, maybe on occasion, but not on a consistent basis, because
80 grams or 80%?
80 grams of protein
80 okay.
daily, which is not considered low fat, guys. 80 grams of protein is not considered low fat. It is not considered high fat. It is right in the middle. If you don't get more than at least 30 grams of fat, you do not have enough to make your thyroid hormones, plus myelinate your nerves, plus create the lipid bilayer, the phospholipid bilayer of all your cells that are in apoptosis, and things that need to be rebuilt in the body. So, it's just not enough. But yeah. You probably lost a lot of lean muscle mass too on
that. Gained 8 to 10 pounds at the beginning. Okay, so I'm guessing just from this that you're up 6 at this point, potentially. Yeah, it's very frustrating. I would track your macros, what you're eating. I would try to intermittent fast, just like your overnight, keep pushing your meal out, like make your first meal of the day a little bit later, try to get to like an 18-6 or something like that. If that feels good and you can do it. I happen to believe that how long have you been on it? 5.5 months. Okay. You're probably still doing a lot of healing. So I think you need to track, see how much you are consuming. Also, you need to know your hormone panels. I think you need to get your sex hormones and your thyroid hormones checked. And I'm talking about the thorough checking, and that if you do need to supplement, it needs to be bioidentical. I mean, there are a lot of moving parts here. Then you have to check out your sleep and your stress management and all of those things, because they play a role. But yeah, I would stop worrying about,
vitamin P.
Low fat, I would kick that to the curb. I think that there's nothing wrong with sticking to the fat that's attached to your protein and then cooking in your additional fat. So whether it's duck fat, bacon grease, tallow, whatever you want to do to make sure your burgers don't stick, or make sure that your eggs flip over nicely and stuff like that extra fat. So I think we've covered that one. I'm going to go to the next question. CJ,
this is yours.
I think it just depends on what it is that you're trying to accomplish, how much time you have to invest, and what your personality type and the type of student that you are. If you are highly motivated and you are capable of teaching yourself, I believe that I am biased, so this is my disclaimer. Liberty University has a very rigorous and very good public health program.
They have a lot of great programs.
They
Just
do have a lot
they're
of great
just really
programs.
great university. They're just
Yeah, they are, and I will also tell you that they do it from, and if this does not sit well with you, that's fine. So if this resonates with you, take it. If it doesn't, that's okay. It's a Christ-centered approach, which is,
Mhm,
very humanistic. We care, the whole person.
mhm.
Um, and don't lie, don't cheat, don't steal, all of these things that the tenets of Christianity are kind of interwoven into the
Mhm.
program. um, I know people that have gone through the program that's not part of who they are, but they were still able to be successful and had a good outcome in the program. Now, depending on what if you need to be in a classroom every day,
Mhm.
in order to feel like you're engaged and to be motivated to learn, then maybe you do need to go to your local university. Um, but or you can do a combination of both. But like at Mason, I teach in-person classes only. That's my preference. I want you sitting in my class. I want to see who you are and interact with you. Um, but you can do hybrid, part
Mhm.
online and part in person. So you just have to really check. And of course, if money is an issue, again, Liberty hasn't raised their tuition in 10 years. So there you go.
And Displaced Hoosier saying congrats, CJ, on your bachelor's today. Yes, congratulations.
Yeah. Awesome.
So Janet, I like what she's saying here. Yes. So since the ADA is an independent organization and it is recommended, would you be able to mention their competition?
You know,
Yes, I think so because this is me, of course, but I'm on the opposite. I'm on this side of the fence. I think so because we recommend different, you know, recommendations for drugs and stuff on like that are on two different sides. So you have the ADA and now you're going to have the ADS. And now it is your turn as a
mm,
clinician. It is your responsibility to continue to learn and study, and you get to look at the ADA's recommendations, and you get to look at the ADS recommendations, and you get to think critically for yourself as a human and say, these make more sense. This is what I'm going to recommend to my patients. And that's the way it is. That's the way it's supposed to be. And that's called evidence-based practice.
mhm.
Supposed to think critically, look at the evidence, and then make your own judgment. The ADA is bought and paid for by a lot of corporations, and they
Mhm.
literally are just a 501. It's just a nonprofit organization. It is not government. It's
Yep.
not even ran by the government.
So Displaced Hoosier gave us a bunch of
Some more
more
stuff. Moving from
information, and
pre-med to
looking at
OMAD.
this. Um,
Okay, so I love Dr. Barry. I really, 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 really do. I do not believe that everybody needs to be on OMAD. Just he is a 50-something-year-old male,
mhm.
and he absolutely can do OMAD. I do not believe that women need to be OMAD. I believe 2MAD is probably good. And
Yeah.
that's because we are different. We are
Mhm.
very different human beings. And I think that we need at least 2MAD. I'm sorry.
Yeah, I feel better when I eat twice a day, but I think that you're gonna get some clues when you get your thyroid checked, and make sure you ask for the full
Mhm.
thyroid panel.
Let me see. Did she
And
talk about thyroid someplace?
yeah, she did. She's getting her thyroid checked, and also, you've been on levothyroxine for 20
Mhm.
years. And have you ever thought about maybe going with a bioidentical, like Armor or?
I will say that right now I'm trying to get anybody to go on a Armor Thyroid. I now know why doctors don't want to prescribe it now that being through advanced pharmacology class. Because the lie that they're telling, and maybe it's not a lie, maybe it's not. I think it's a lie. It says in the pharmacology book that laboratory testing has shown that they are inconsistent dosages and that you never know what you're getting with desiccated thyroid. But then but then it goes on to say that in one grain, it has this much of this and this much of that. So that's why it's going to be hard to get people to go through desiccate to get you to get on it. Go ahead.
Pick me.
Mitzi, I am calling on Mitzi.
So do you think that if you take this pharmaceutical pill
Mhm.
and I take the exact same pharmaceutical pill and the same dosage,
Mhm.
that it is going to have the same physiological effect in my body?
No, it all
It
has to
isn't.
depend on your anatomy, the chemical processes going on, the pH of your stomach,
No,
all the
it's
whole shebang.
yeah,
That
yes.
is, I do believe that is either is that pharmacokinetics or is that the dynamic portion?
It's
Yeah.
pharmacokinetics, but yeah. So it's I believe it's a lie. I can't prove it, but my gut tells me that's a lie.
No, I mean, I'll tell you, I went on it. It took me a lot longer to get stable on it. And this is super important. And if you are going to
Yeah.
if you want to get off of Levo and get on to Armor. So, and there's a lot of different desiccated ones out there on the market. There was actually a new one. I think it's called WP. WP is the new one. It's a generic desiccated thyroid. So it's a little cheaper. Whatever you do, get one and stick with that brand. If it is Armor, stick with Armor. If the first one you get is NP thyroid, stick with NP thyroid. If it's WP thyroid, which is the generic, stick with that exact manufacturer. And that's because those should be literally the exact the should be the same across all laboratory testing. So it's not about, and this is why even like if you're taking it with coffee in the morning, they're like, don't take it with coffee. It's bad. If you're taking it with coffee every morning and that's how you're taking it and you're doing your dosages based on that and you're stable, take it with your coffee every morning. It is okay because you're taking it the same way every day and we've got you on a stable dose. However, go ahead.
No, keep going.
No. So with that, you want to take the same brand because you know it's going to be the same laboratory testing, the same contents. And if you get regulated on NP and then switch to WP or Armor, it might throw you off because theirs might be a little bit different enough.
Okay.
Where
So
bioavailability might be a little bit different for that one.
so we have like 7 minutes left and a bunch of questions, and I'm
Oh,
gonna
okay.
I'm gonna do
Okay, I'm glad you're not
some of these are quick and easy. Would men have the thyroid affected too if they're low fat? Absolutely.
Yeah.
Men need fat too.
Yeah. And
It
thyroid
makes
hormone isn't made out of fat. It's actually made out of, I think it's tyrosine.
but sex hormones are made on a
Out of
on a
fat.
backbone of cholesterol, and if Mr. Happy wants to be happy, you need cholesterol, and cholesterol comes from animal products, and animal
Yes.
products usually come with fat associated. So, yes, this can have an effect. He's a whole food workout maniac. Okay, well, too much working out can have the opposite of the intended effect.
Oh,
Then
yes, very much so.
the next question about a
The next
broken ankle and you can't
question.
get the 100 grams of protein in, protein powder. Equip protein powder is a clean one.
Equip, if you're okay, there's another brand that's new out called Noble. And I've looked at the ingredients. The ingredients look pretty clean. There's another one out there, and I think Noble might be the one that has blood in it. Like, yeah, it's like tip to tail. I don't know if that's Noble, but there's another one that does have the blood in it too, that's against my religious beliefs, so I stay away from it. But if it's not against your religious beliefs, then it might be interesting.
Oh, okay.
I only recommend Equip. Or
I
Keto Chow has a beef isolate. I want the beef, not the whey.
yeah.
So this one is okay, lightning. I
Yeah.
know this is lightning round. Do you believe that you have to use bioidentical hormones? Yes.
Okay,
Um,
but can't you balance them without the hormones? Balance, not raise. Aren't they supposed to be low after menopause? So what happens in menopause is your ovaries stop creating these hormones and your adrenals take over.
yep.
What else do your adrenals do? They handle your stress and
Mhm.
they've got a busy job keeping you alive. And if they've got to partition their work, they're going to say, we don't need to be making hormone. We need to be keeping this crazy person alive.
Yeah.
And therefore, you are suffering from low hormones. Now, if you're going to replace them, it needs to be bioidentical. You don't want something that almost fits the lock.
Well, and there's a reason for that. And that's because if you look at the studies on
Mhm.
the non-bioidentical, so the ones that were created, and the horse urine, which is Premarin, by the way, if you go and you look at those, the studies have shown that it increases the risk of so many bad things, including clots, breast cancer, all kinds of different things. It's a laundry list like this that it contributes to. So bioidentical is more important. However, everybody thinks that your estrogen goes down. Well, your estradiol goes down. However, that only like is needed for about 2%. I think it's like 2 to 8% of your bodily functions. And estradiol only kind of really goes towards reproduction. The next one is estrone, and that's the predominant one after menopause. I think it's the estrone, and that is taken over by the adrenals, and that's the one that's the most important anyway, after menopause. So yeah, estradiol's not. They give you fake stuff now, and
Yeah.
it's for you.
Yeah, CJ makes a good point. Levo and Synthroid have been recalled several times because of inconsistent levels. So,
I'm like,
um,
where are you at? I can't even find it. Is it this one?
eh,
Mm,
yeah.
yeah, they have been.
Mm, okay. Well,
But
if
they have
they,
not. Mm,
yeah. So if they won't ask for it, ask them to document it in your record.
yep.
You ask for it, and then maybe you can purchase it
Own
on
your labs.
your labs. Unfortunately, and if you have, yeah, I'm
A full
sorry.
thyroid panel on Own Your Labs, I think, is about $75. And that's if you get the TPO antibodies, it's a
Yeah.
little bit more. It's pretty expensive,
Yeah.
just because those
Well,
antibodies.
I, so I'm based upon this next comment about it's been in the mid twos and you've never changed from the original
Oh, I'm
dose.
so sorry. How do you
I don't,
feel?
I don't know that you're being well managed.
Yeah. If you don't feel good, what could the full panel show me versus horrible TSH with reflex? I mean, it'll tell you what your T3 and T4 is and whether you're making antibodies against the T3, like you're doing like a reverse T3. And it'll show you how well you're converting the T4 to T3. And it'll tell your uptake on whether the T3 is actually being uptaken. It's weird by the cells. But you really need a full panel. And I don't know how you feel, but I have Hashimoto's also, and mine, I finally got mine down to 0.86, I think is where I'm at now. Finally. And I feel much better. And they had to almost double my dose to get me there.
Hey, the next question is really good, Janet.
I don't know anything about MTF.
Okay. Okay. So MTHFR means that you cannot properly methylate. So
Yes.
taking the methylated B12 is what you need to do.
Yes.
And here's another thing for all you listening going, I don't know if I had MTHFR. Just take methylated B. Skip
Yeah.
the step, give your body the break, pay a little bit extra. You don't have to worry about whether you have the
That's what I take I take that anyway, just because I'm a little bit low on.
Mhm.
I take B12 even though I eat a lot of beef because I tend to be borderline anemic anyway. So I
Now,
take a little bit of iron and a little bit of B12 just for shits and giggles.
okay, so by it, I mean artificial thyroid meds.
Where?
Yeah, where she said, ask the doctor how your body will methylate it if it won't methylate B vitamins. Yeah. How's your body going to methylate the synthetic thyroid medication if you can't methylate? That is an excellent question, Janet. You win the internet today.
Yeah,
You,
I don't know.
you're
I didn't know you
dangerous
needed
being
to.
so
I didn't know it
logical.
needed to be methylated. So you're one up on me. I'll have to
Well,
actually go and study that.
so yeah, so if you know for a fact that our body has to methylate
All right.
that is interesting. Now, see, I'm such a
I'll have to
nerd.
look. I'll have to look that up and see what the
I'll go
process
into the
is now
medical
for.
library to look
Yep.
at that.
Yep.
Okay.
Love you too. So much knowledge and common sense.
Oh,
Thank you. I common sense is so not common these days. And if you just made my day because you said I have common sense.
oh. My computer is acting up. Okay, we're back. Sometimes it just goes to a black screen. Uh, uh,
Yes, please do follow up with us.
yeah, and Janet,
Yeah.
she's been denied armor. So you can say, "Can you please write for the armor? I will pay out of pocket." And when you go to the pharmacy and you say to the pharmacist that you're paying out of pocket, there's a different price than if you were paying by insurance.
Well, I don't
And
know but why is it the doctor, Janet, is it the doctor that is denying it? The doctor is saying no? I'm waiting to see because here's my thing. If the doctor is saying no, this gets me every time. So then you look at the doctor, you say, okay, I would like for you to write a letter and place it in my daughter's chart stating that I have asked to change medications because the current therapy is not working and you are denying us the right to have her properly managed. And if that doesn't get it, then you make sure that gets put in there. If not, then you write a letter.
yeah.
If it's like, I'm not doing
So
that.
so
Well, then
she's
you
being
write a letter and have it uploaded to the
yeah,
record.
she's being denied because she is, I think, self-pay.
Mm.
And they don't even want to give her the full thyroid panel.
And
Yeah,
fire your doctor. Just fire him. Find somebody else. I don't care. I don't care if she's the lowest income person on
this
the face of the planet. Go to a different doctor and flip this guy off. I want you to go get her records and say goodbye. And I'm going to go someplace else.
wow, she refused to have them kill her thyroid.
Whoa, 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 whoa. What do you mean kill her thyroid?
And
Why would
has
they
been
want to
approved.
kill their thyroid?
Well, I mean, like,
Okay. I thought you meant literally, as in like they want to give her radioactive iodine. Why?
right.
Okay, so you mean like, okay, so she's been improving her health. That's good.
Yeah. Yeah.
However, she needs an endocrinologist that is willing to a family practice. So many of them are scared to do thyroid because if it goes out of whack just a little bit, it can have some weird cardiac things go on, like palpitations, and it freaks them out.
Yeah.
Just go to an endocrinologist. Ask for a referral to an endocrinologist. Yes, Art. The Art has a good point here, Janet. Ask the pharmacist which doctors prescribe armor.
Yeah. So, yeah, and the way that you could phrase it, just kind of make it benign. You can say,
welfare,
I'm
you are
looking.
locked in. You don't get a choice. Wait,
Um,
what? What? How is that? How is that fair? If you get stuck with a crappy doctor, you just get crappy care. That's not fair.
wow.
That makes me mad.
Yeah.
Sorry,
It is.
y'all. You get
It's
to see my
infuriating.
personality coming out, and sometimes I need to bottle that. Just kind of put a lid on it. This is why I'm doing what I'm doing because I want it to be fair and equal for everybody.
Yeah. Well, equal access and,
Yeah,
health disparity.
everybody should have equal access.
I agree.
Pharmacists
All
know
right.
who's prescribing what. Yep.
Well, I'm going to have to.
You gotta hop off.
Well, what time is it? Is it like 5 after? I could probably stay 5 more minutes, but I don't think we have any more. I want to make sure. I'm just going to make sure we didn't miss any questions.
I'm one of those people that like we end up going. I'm like, I'll just keep going.
And then I just want to say something else about the question about can you balance your hormones on your own if your levels are low. If you clean up your diet and you're following the proper human diet and you're healing and your blood sugar control management is, under control, then your adrenals can pick up the slack. And if you're postmenopausal and start making more, and you will feel better. The key to it is it's based on how you feel, and they do the tests, and my provider is pretty liberal, and she'll say, try 2 clicks and see how you feel, and if 2 clicks is too much, then go back to 1 click, and she gives me that space she's willing to work with me. So but yes, if you clean up your diet, your hormones will balance out, and that is why, as Dr. Barry says, and I used to, when I coached before joining Dr. Barry, when I was with Keto Con, Hack Your Health, or whatever, I used to coach for them. If you were not menopausal, I asked flat out if you were on birth control. And they would say, well, that's like a weird question. I'd say, it's not a weird question unless if you don't want to have a kid, you better get on birth control because you're going to become fertile myrtle. And we had several whoopsies.
Oh. Well, I mean, something, and this is anecdotal, but I've seen this where my dogs are about to go crazy, by the way, because I guess my husband must have got me flowers because they're being delivered. They are.
Okay. Wow. All right. That's cool. She's getting flowers. I didn't get anything. Okay. Yeah, you can source it from south of the border. Well, they're very strict about going to Mexico or to Canada to get your meds, and they're real assholes about it. And, so shame on grandma who lives in New York. She can't go to Canada to get her medication filled. Oh, those are beautiful. Is that for finishing the semester?
For Mother's Day.
Oh, for Mother's Day. Oh, you get to enjoy them over the weekend.
I know.
Very nice. And I'm with my mother, by the way.
Happy Mother's Day from your loving family.
Oh, that is so nice. Yeah.
And it's one of my favorite colors. My second favorite color, purple.
Yeah. I kicked my kids to the curb and I said, I'm spending Mother's Day with my mother.
Well, I wish I had my mom. So everybody that can, number one, let's just say it. Happy Mother's Day to all the mothers for this weekend. Hope you have an amazing, amazing day. If you still have your mother, please hug her, spend some time with her, tell her how much you love her. If you are estranged from your mother, if there's a way that you can somehow not be estranged from your mother, and work on that relationship, please do, because I miss my mama very much. So she died in 2019, and so it is beautiful. They're very. My husband must have ordered it because my daughter had been wanting to do something for me, so she probably came up with it.
Well, he should have also put on there, congratulations for finishing the semester and gotten a twofer.
I know, right? I know, right? So yes, to all the moms. And who is cupcake with sprinkles? I love that. Happy Mama's Day, cupcake with sprinkles. I love seeing some of these people's stuff. However, whenever Dr. B reads some of them, that they are intended to be very dirty. And then I'm like texting Nisha and I'm like, Nisha, don't look it up. Tell him to stop saying it.
Yeah. Or how about Master Sergeant? He's calling him MS.
MS. He's like MS. I was like, that's Master Sergeant. And then I get upset. No offense to Master Sergeant out there, whoever it is. That is not how you abbreviate Master Sergeant.
It is for him.
Was the Air Force or something else?
Yeah, the Air
Oh,
Force,
the Air
Marine
Force,
Corps.
then that's different. Then
Yeah.
that's different.
Yeah,
But if it's
totally.
if it's Army, it's MSG. If it's first sergeant, it is 1 SG.
Yeah.
Yeah. But yeah,
Yep.
I see that and I'm like, MS. No, not a master's of science or multiple sclerosis. That's master sergeant.
All
Which is
right.
what my husband is. So
I think I gotta go because I got a 1:30 meeting I gotta prep for.
well, bless y'all. Hope y'all enjoyed this, guys. I enjoy doing this. It's just fun to get on here and chat to people. So yeah, if anybody has questions, hit us up in the community. If you are not part of Dr. Barry's community and you just happen to stumble upon this, I would encourage you to go to, I think is it PhDcommunity.health or I don't know the
Just
thing.
look up Dr. Ken Berry, PhD, and you'll find
Yeah,
it.
and you'll find it. Join the community. It is super supportive, and you get a lot of stuff like this from all of us out there, all of us coaches. There's about 10 of us, and I think one in the making, maybe. And yeah, so
Well, you're very welcome. Thanks for all the accolades, and I'll see you in the community.
we'll see y'all in the community. Have a good day, guys.
All right. Bye.
Bye.